Okay, welcome to Chapter 12 of the Nasm 7th edition, Certified Personal Trainer textbook. And Chapter 12 is going to move forward now from what we did in Chapter 11, which were assessments, but the changeover now is to postural movements and performance assessments. So the initial assessments we did were just to collect data and information and do some cardiovascular uh, assessments, things like that. So if you remember from chapter 11, the rapport test and the other assessments, YMCA 3-minute step-up test. Now in chapter 12, we move into looking at people's posture, uh, looking at movement components like the overhead squat assessment, and then performance assessments. Chapter 12, very, very important. And so before we start, remember, have a sheet of paper so you can take notes and drawing. I actually have a marker that I'm going to use because I'm going to do a little a drawing for you and do a little overhead drawing so you can kind of get an idea. One of the best things to do, I believe, for studying and memorizing a lot of the material as we continue to move forward through this particular section, finishing up this section and then moving into the later sections, is to draw. And if you don't like to draw, I get that, but it really is very helpful to. It's kind of like the writing component. There's the physicality of doing it actually helps retention. So if you can draw things conceptually, it will make sense. And so that's what I'm gonna do in this chapter, and hopefully it'll be helpful to you. So the chapter starts out with again, the learning objectives are good to kind of read through, get that general idea, and then an introduction to the actual assessments themselves. And we start off with in chapter 12 the importance of posture, and can't really overemphasize why posture is so important, proper posture. And it comes down to this idea of muscle imbalances. And because people sit a lot, we don't exercise a whole lot in general, we get these problems and issues, or what are known as distortion patterns in our skeleton. And because of that, it can cause pain, it can cause other disruptive um, problems to occur over time. See, the thing with posture is that it doesn't just cause a problem today or next week. Postural issues take time to develop. And so what we want to do is right off the bat, when we're looking at our clients, is get a good idea of what their posture is. And so we need to know what ideal posture is before we can actually see the distortions. And so that's kind of the focus here when you're doing these assessments, particularly the postural assessments. Movement assessments, or the dynamic components of these assessments, um, are also very important. But we start out with this understanding that posture and just this static positioning, when we look at people, is really important. So I would say the best way to start this off is to understand um, basically what, and I'm just shifting over to my overhead view, is looking at not only why it's important, but what ideal posture really looks like and why we get muscle imbalances. And so we've done this before, but when you look at the spinal column and you look at the skeleton itself, remember you have your skull, right? And you have your skeleton, which has three curves to it, right? This cervical, or what's known as a lordotic cervical curve, right? So this is looking to the front, right? That's to the front. And this is obviously over exaggerated, but that cervical curve, okay, needs to be lordotic, or it needs to be in a curve. This thoracic or kyphotic curve, again, this is over dramatized, right? But that needs to be that shape, right? This curved out. And then the lumbar right, or lordotic lumbar curve also needs to be in the same shape as the cervical curve. Now remember, this is a lateral or side view, and this would be considered the normal S curve of the spinal column. Now, as you go through as we go through the chapter, they're going to give you some really good figures, some pictures to look at. But if you keep this in mind, that those three curves are critical, now we can move on to a couple of the um, uh, more important components of posture. So with those three curves, okay, we get a good idea of how the spinal column should be shaped. But we also now need to look at the other joints of the body, in particular the pelvis, and up here would be the shoulder. Okay, so those are going to be the two areas that we see most of the dysfunctions occurring. Not that we don't get dysfunctions throughout the entire spinal column and skeletal system, we do, but it's because of the complicated nature of the scapulohumeral and upper arm kinetic chain that we see a lot of issues that we're going to talk about in just a minute. The same thing with this area down here, what we call the lumbar, pelvic, and hip complex. So you'll see LPHC, the lumbopelvic hip complex. So we're going to see the issues and problems that are associated with dysfunctions in these areas. Keep in mind there is a sort of ideal posture that we all need to maintain. And when those postural positions are not maintained and you move into these distortion patterns, there's pain, there's discomfort, and other musculoskeletal issues that can come about from that. So it's important, again, keep this in mind, that the three curves and the fact that there's going to be issues up here in the scapulohumeral area up in the shoulder, okay, and the LPHC, the lumbopelvic hip complex. So I'll put that up under here. The reason, and so if you understand that, the reason these are generally occurring is because of what are known as muscle imbalances. And on page 383, you got this picture, this figure 12.1 of muscle imbalances. And so it's important to kind of understand how this occurs. And what I'll do now, figure 12.1 is giving you this, it's giving you a line and just showing you muscles on either side. But I think it's even better if we look at an actual example. And again, forgive the quality of my drawing, but I want you to see a good example of what we're talking about with muscle imbalances. And what I'm going to do is I'm going to show you with the biceps and the triceps. So that is the humerus, the upper arm. This is the elbow, and then this would be the forearm. So the idea is that if we look at the biceps, muscle on one side, right? And let's just go ahead and draw the tendon down, okay? So this would be the biceps, right? And then I'm just going to draw the triceps in a similar way as the biceps. And the triceps, of course, are on the other side of the elbow joint, but they both work over the elbow joint, okay? So they both work over the elbow joint, and this would be the tricep, okay? And so one works to flex the elbow, one works to extend the elbow. So the movement of the bicep counters the movement of the tricep, so that you basically have a muscle on either side of the joint, which is what you're seeing in figure 12.1, which is basically the muscle attaching up here, and this is what their drawing is showing you, right? And here, okay. So this right here would be the joint. I just think it's a little bit easier to understand the picture by looking at it from this perspective. So Bicep, tricep, the elbow joint. The elbow joint then is going to be that point of pivoting. And so the bicep and the tricep have what are known as ideal length tension relationships. And we've gone over this in a previous chapter, simply meaning that ideally, this is under perfect conditions. The length, the length of the tricep has an ideal, there is an ideal length where the muscle likes to, quote, likes to stay in, as well as the bicep. It likes to stay at that length when it's at rest, not doing anything. That's the ideal length tension relationship. However, as with any groupings of muscles, if you keep muscles in a certain length, or if you shorten a muscle, for instance, because you're sitting down a lot, your hip flexors will be shortened. If you were to keep your elbow bent, right? Bent so that it looks like this all the time. If the elbow looks like this all the time, the bicep becomes shortened. Okay, so the length here, you see the elbow. If you look at it this way, the bicep essentially shortens, right? Because you've pulled the joint into a decreased flexed position. Okay, so now this length, and this length are different. In other words, this length, well, not according to the picture, but according to the concept, this length would be shorter than this length. Okay, and we have a scenario then where the bicep is no longer in its ideal length tension position. It's in a shortened length tension position, which means, I don't have to tell you this, what happens to the tricep? Well, obviously the tricep is going to be lengthened, right? Because it's being pulled and lengthened because of the relative flexion angle of the elbow. And so if this came over here, you can imagine that this length then is this length will be shorter than this. These muscles are now in what are known as altered length tension relationships. The bicep doesn't want to be that short, but you made it that short because you're like this all day. Okay. Same thing with your hip flexors, and your tricep does not want to be that long. It doesn't want to be lengthened like that. It would much rather be shorter, so to speak. And so this scenario of ideal to the real, which is what we live with, we do to ourselves all the time, okay, creates what are known as muscle imbalances. And then there's an it's changed, it's less efficient than it should be. And that's the scenario that we're basically looking at. If you can get this, if you can understand this concept of this altered length tension relationship, these imbalances that occur, okay, if you can understand that muscle imbalances is what's sort of pulling the joints, pulling the body segments out of proper alignment, okay, and that's what the distortion patterns, a few of these distortion patterns that we're going to talk about, that's what they are. That's really what's causing them, are these muscle imbalances for the most part. So that when we look at a joint and we look at the opposing muscles, and there's multiple opposing muscles that work over these joints, if you sit down a lot, for instance, your hip flexors, and I'm just going to draw the torso and the head, right? So here's your legs, right? So I'm making this real simple. Hip flexors are those muscles that move the legs closer, right? Move the legs closer and reduce this angle right here, right? So those are hip flexors. So if you were to sit down a lot or consistently day after day, right? Day after day, and that's all you do is you sit a lot in front of a computer, what have you done? What have you done to the hip flexors? Well, you have shortened them. You've shortened them. And by shortening them, okay, they move into this shortened position consistently over time, and then they start to take on an altered length tension scenario. In other words, they become tense in this shortened position. And then, of course, muscles that extend the hip, those type of, this scenario is the same thing. You saw that with the bicep and tricep. So I hope it helps when you kind of look and draw it out. All you really have to do now, in one sense, and maybe it's easier said than done, and I guess it is all you have to do is, if you understand this conceptually, just memorize the muscles that are hip flexors. What are the hip flexors? What are the hip extensors? Okay, and as we go through the chapter, you're basically going to just memorize all the muscles that are involved in these particular movements. And then once you do that, once we know what the hip flexors are, right, and you can memorize the iliopsoas, the rectus femoris. Once you memorize those muscles, now you can get an idea of, are they going to be shortened or lengthened? And if you know whether they are shortened or lengthened, you can start using and understanding the terms over and under active. Because this is what defines for us, this is what defines whether muscles are shortened and under tension, they are overactive. That's a generally, it's not true all the time, but most of the time. And those that are lengthened because of what you've done to it posturally, right? They're lengthened and they're not providing enough tension, right? They're not providing enough tension because you've lengthened them, and now they have an altered length tension relationship, which makes their positioning not very ideal for power development. They become what we call underactive. They should be more active. They should be pulling the joints back into appropriate position, right? So ideal posture is standing up, not sitting down. That's kind of the idea. Now, that's just this area of the pelvis, but I want to make sure that you understand that this also occurs in the shoulder region. And that's, again, why we look at muscle imbalances on the entirety of the skeleton, but we're going to see it mostly in the LPHC and the scapulohumeral area. Now, just keep in mind, these issues and these problems affect all the other muscles, for instance, down the leg. And that's why you're going to see on some of the lists in the chapter muscles that you would never think. Why is the gastroc overactive? Why is the soleus overactive or underactive? And the reason is because every joint is affected by the joints that are proximal to it as you get closer to the midline of the body. So let me go ahead and get out of this. And so I hope that makes sense. I wanted to make sure that you take a little bit of time to understand and even draw it out yourself, because once you start getting into the rest of the chapter, if you can get back to this and think about it, conceptually, it's going to make a lot of sense. So that's posture, muscle imbalances. As always, you have sidebars, definitions that you definitely need to know and memorize. And in one sense, I've basically covered a lot of material just by drawing those for you. Now, the assessments themselves are going to be listed here for you as we get from page 384 onward. The static postural assessment. The key about the static postural assessment is that you simply have a person stand there and you're going to look at what are known as the 5 kinetic chain checkpoints. Okay, there's 5 of them. Just think about it. Look, thankfully, there's not 100 of them. Okay, and a kinetic chain checkpoint is simply that main area of the body where we see a lot of motion and movement, the neck and the head, right? So that's one area that we want to look at because that can get distorted. Okay, it can move out of position. From the side, it can be jutted forward, for instance, like an upper cross syndrome, as a for instance. So that's one area. The next area is going to be the shoulder or the scapulohumeral shoulder girdle complex, right? And that's all the movements of the shoulder, movements of the scapular, protraction and retraction. Okay, so that's 1, 2. Then the next is the LPHC, the lumbo-pelvic, that entire region. That's another kinetic check, one of the 5s. That's number 3, the knees. And then the ankles. Now, if you want to start from the floor, you would say ankle, foot, knee, LPHC, the scapulo-humeral shoulder joint area, and then the neck and the head. So those are your 5 kinetic chain checkpoints. And the reason you need to know those is because when you do the basic static postural assessment, you're looking at all 5 of those. Now, truth be told, you're not looking at all of them from the back, the front, and the side generally. And there's actually there's a tables here that basically take all this information, read through it, of course, but like I said, use the tables to really hone in and maximize the accumulation of information in a very efficient way. The idea is that certain of those kinetic checkpoints, like the knees, when you're doing a static postural assessment, you're going to look at it from the side and from the front. You're going to look at the head from the side and from the front. You can look at it also from the back. You need to see the way the scapula are positioned. And that's really what you're looking at when or what we're looking at when we're doing the static postural assessment. Now, the 3 main distortion. Now, think about it. I'm looking at the average person, and very rarely have I ever looked at a client and gone, boy, that's perfect. You have perfect posture. No, they always have some issue or problem. We all do to a certain extent. But there are 3 main distortion syndromes that we look at that you've got to know that really are important when it comes to the training process and exercising. Look, if there's an issue with the wrist or the elbow, not so much of an issue. But when there's an issue with the pelvis and an anterior or posterior tilt and hyperkyphotic curve, for instance, or protraction of the scapula, that's actually going to be a problem when it goes to train people. So we need to know these: the Pes Planus Distortion Syndrome, the lower crossed syndrome, and the upper crossed syndrome. Now, again, 12.1, 12.2, and 12.3 is where you're going to focus and hone in as far as memorizing the materials. So, by the way, in each of these tables, it tells you the static position and what kinetic chain checkpoint you're looking at. So, for instance, in the Pes Planus, you're looking at the ankles. Why? Because in that syndrome, it's flat feet. By the way, that's the normal English term is you got flat feet. Now we say that, but it's really can be very problematic because it creates this inward rotation and movement of the knees. And there's a reason for that. If you're just going to memorize the over and underactive components, okay, but it's really helpful to actually know, why those muscles are over or underactive. And of course, those are the potential muscle imbalances. And it's not a bad idea to draw this out and sort of draw out where those muscles are. And if they are lengthened, right, underactive, or shortened, overactive, you'd be able to notice it. Same thing with the lower crossed and the upper crossed syndrome. So that's your static postural assessment. The dynamic posture now is a way to assess not just the skeletal structure and muscle imbalances, right, that are already there, But now what we're going to need to do with an individual is we're going to need to see what happens when they start to use their motor control of capabilities, right, to do basic movements. One of those is the squat. We call it the overhead squat assessment, the OHSA, right? Way to remember it. And if you look on page 388, that's going to give you an overview of the overhead squat assessment. Remember, the goal is to look at the five kinetic chain checkpoints while they're doing the movement, and you have an entire explanation. Basically, the overhead squat assessment, you got to have better to do with bare feet so you can see the ankles and the feet as they're moving. You also have to make sure that when you're doing it with individuals, you sort of preempt it with an explanation. You're going to do it slow. You're going to do it smooth. You're going to do A, B, and C. And I'm going to be sort of moving around you, looking at it from the side, from the front, and from the rear. And so on page 389, that's what you're going to see: anterior view, lateral view. Which one of the kinetic chain checkpoints are you looking, or multiple that you're actually looking at? And so here are the issues that you're going to see, though, particularly when you look at figure 12.7 and 12.8 and 12.9. What Nasm has done again is they've given you a very good, concise, controlled element of material, if that makes sense, right? They've taken the material and it's in a controlled fashion into a table. Probably not the best way to explain it, but they've done a really good job of taking this information and giving it to you right here. So read through it, but the tables is where you're going to spend the majority of your time. And so the solutions chart is where you're going to try to read it, rewrite it, and basically memorize. So as an example, the table 12.5, the foot and the ankle. Normally, we look at the foot and the ankle on an overhead squat assessment from the front, so we can see whether or not there's movement, right, of the foot into a flat-footed position, and they're going to basically say, what are your potential movement impairments, possible muscle imbalances, and you got to memorize those. So that's kind of the idea, is that you can memorize 12.5 again. These assessments are designed, as I move through, these assessments are designed to help you to get an idea of those muscles that are going to need to be strengthened, right? If they're underactive and they're lengthened, that tells you right off the bat, when you start your programming, you're going to need to spend some time strengthening those particular muscles, as well as stretching and getting the overactive or shortened muscles to get to their ideal length tension relationship position. You'll see quite often I'll have to pull and stretch because I feel my shoulder girdle protract forward. This is why over time, if you don't stretch and get up, like I'm sitting a lot, I got to get up and stretch out a little bit. Why? Because after a very short period of time, it doesn't take very long, 10, 15 minutes, those muscles like my hip flexors and my pecs, for instance, my serratus, all of those muscles start to pull and shorten because of the weight of my torso starts to move forward, and I start to go into a poor postural position. You got to get up and get back and stretch and try and strengthen the muscles that are elongated. So that should be helpful. Then these solution charts are really where you're spending the majority of your time with your memorization of the muscles. Single leg squat assessment. Look, this is going to, as they say, evaluate dynamic posture as well as lower extremity strength and balance and overall conditioning. Not everybody is going to do a single leg squat assessment. And Nasm basically says, you only use this for those individuals that do well on the overhead squat and have the essential balancing ability to do a single leg. So single leg squat, starting position, of course. Now we move into the pushing and the pulling assessments. remember, the assessments we just talked about with the squats are all lower body. Now we have to assess the upper body, and we have to check to see whether or not there's muscle imbalances in that scapulohumeral part of your body, right? So whether the scapula is protracted, right? You're going to have underactive muscles in the back and overactive muscles, obviously anteriorly in the front. So you got pushing assessments and pulling assessments. Just keep in mind, it's going to be really hard to do these assessments without cable pulley machines. But if you can get and you can use them, then they're very effective. Again, go to your tables, your solutions charts, and look and make sure you know and have memorized the overactive and underactive muscles, not just to memorize them so that you can answer questions on a test, but this is really important. If you know these things, you can really show your clients that you know your stuff when it comes time to actually train them. And you're explaining a little bit to why you got to do this exercise a little bit more, why you're telling them to squeeze their shoulder blades in the back, and or why you're going to do foam rolling, on these particular muscles. Or you can explain to them why you get these trigger points, right? Which is what people will get, especially up in their upper trapezius. They wonder why their neck hurts. Well, it makes sense if you have what's known as upper cross syndrome. You got the movement of the head jutting forward. Ironically enough, even though the head is forward, the cervical spine is actually going through extension like this. And so these cervical flexor muscles actually become underactive and they get lengthened, and yet the extensor muscles. Why? Because normally what we're doing is we're looking down and we're looking like this. And so what happens if I'm like this all the time? If you can see me like this, what's going to happen? Cervical extensors, right? This is cervical flexion, cervical extension. So if I'm like this all the time and I've got protraction, you can see, all you got to do is take a look at some of the pictures, do it yourself, and you'll understand it. So those are the pushing and the pulling assessments. Now, again, your solutions charts, very helpful, very effective. Look at the visual cues that Nasm has given you. You may not see this while you're training with people, but it gives you a good idea, a good understanding of what's actually happening. Remember, not only seeing folks, but asking them. You would have gotten a little bit of information when people complain about lower back issues. They complain about their neck hurts all the time, right? They're always, they're really tight in their traps. Well, what is that telling you? Now you can figure it out and actually get it on paper when you do these assessments. So now we move into what are called performance assessments, right? So you've done the postural assessments, both static and dynamic. You've done these push-pull assessments. Now it's time to get a good idea of where your client is at from a muscular strength and a muscular endurance perspective. We're basically hitting on all of the different things that you would be doing with your client when you're training them, right? You're going to be doing strength training, you're going to be doing muscle endurance training, flexibility training, things like that. Performance assessments are designed to measure, right? They're designed to measure some basic physicality or physical capabilities that your clients have before you start to train them. So we have a number of them on page 400. There is your list. Push-up test, bench press strength. So there's an upper body. Squat strength assessment, right? Vertical jump, power, long jump, right? Those are your assessments. Each one of these gives you a initial position, start position, test position, and exactly what the movement is supposed to look like. So the push-up test, muscle endurance, that's really what it's designed for. And then the bench press, upper body, again, upper body strength test. Squat is going to be a strength assessment test. And you can read through that and get a better idea of exactly what they want, what they expect, and what they want you to be thinking about when you do these assessments with your clients. Vertical jump assessment, maximal jump height, lower extremity power, right? Power is how fast you can overcome resistance, right? So power has a time element. The faster you can get your muscles to contract, the higher you should be able to jump. So vertical jump assessment. Long jump assessment. Remember, I hope you're understanding that you're not doing these assessments with every client. Okay. And so you got to be careful that you don't just look at a long jump assessment and go, hey, come on, client that's never trained and, he's 50, 55, 60 years old. He's never worked out before. He's got a bum knee and you're having him do a long jump assessment. No, of course not. Lower extremity functional test. Right. This is a lateral movement type of test. We do these with athletes. This is basically what you would do with athletes, right? So 40-yard dash assessment, as well as the pro shuttle assessment. Nothing wrong with reading through and knowing these, but those are very targeted, just so you know. Those are targeted assessments that you would use with basically athletes. And then the implementation of the fitness assessment. Remember sequencing. Okay, page 406. Sequencing is very important. You're not, if you do things out of appropriate sequence, you can skew the results of the assessments that come after. We don't do vertical jump assessments and then do static postural assessments, right? We do it in the way that makes the most sense, the less activity, moving into actual performance assessments. So that's critical to know that. Figure 1228, just write it yourself, write it down, because that's giving you the appropriate sequencing. And rapport building, obviously, that's what assessments also allow for. Remember, you're spending time talking to your client on this. Building rapport, building trust, mutual understanding. Remember, that's what rapport is. Great opportunity to show your clients when you do a reassessment, right? Page 408, reassessment, to show your client what a great trainer you are, so to speak. I'm being somewhat facetious, but the point is that we do a lot of these assessments to know not only how to start, but to show that we've been making progress with our clients in the different parameters that we're looking at. So considerations and modifications. Now we move into the reality of assessments. Be careful if your client is overweight or obese, right? You have to make sure that, like I said earlier, is this really appropriate for this client? You've got to make that decision. Youth. Not every assessment is really designed to be done with youth, especially the younger they are. 16, 14, 12 years old, you may want to reconsider a number of the assessments on the performance side of it. So we're not saying that you don't train youth. We're just saying that you need to be careful when you're doing this. So always keep in mind that when you're doing assessments, older clients, youth, sort of what you would call special populations, folks that are overweight, obese, they have particular limitations that you always have to take into account before you start this sequencing of assessment. So again, we're at the end of the chapter. It's a great chapter, by the way. Read through the summary. Good chapter review, and of course, you've got a fair number of chapter highlights. Spend a little bit more time in this chapter. It's very important, both academically and functionally, when you're actually training clients. Make sure you know the overactive and underactive muscles. Write them down. Make sure you've got it memorized, but not just memorized by the terms. Memorize those muscles functionally. Know where they are and know what they do. It's very helpful. It's very helpful when you're working with clients and you see these distortion patterns, and you are able to go, you know what? Let's go ahead and stop for a second. It looks like you've got A, B, C, and D. Let's go ahead and work and strengthen your hamstrings and your erector spinae, and let's go ahead and stretch out your hip flexors. And you tell me how you feel. I'll be honest with you. There have been more times than I can shake a stick at, where all I've done with a client is stretched out their hip flexors. Right, 9 out of 10 times, issues that I've seen with clients, average everyday people, boom, hip flexors. Hip flexors are tight because you sit all the time. And all I would do is have them lift their leg up, pull it back a little bit, relax, take a deep breath. You'll go through flexibility, and as soon as they relax the hip flexor, and it goes into a more normalized length tension relationship, those hip flexors, the psoas, the rectus femoris, as soon as that happens, their back pain goes away. Why? Because the erector spinae are no longer lengthened and underactive, and they get painful, right? It's amazing. It's really quite amazing what you can do. So spend some time in chapter 12, get a real good knowledge and feel for those muscles, overactive and underactive. And please understand the importance of these assessments. So now we get through with section 4. So that was section 4, which was chapters 12, 11, and 12. And now we're going to move on to section 5. So I look forward to seeing you chapter 13, which begins section 5. So we'll see you then.